Welcome to episode 7 of the ABCs of Cancer Therapy, where we review antineoplastics or supportive medications in alphabetical order. We review drug class, pronunciation, mechanism of action, indications, route, frequency, and of course, side effects. Continuing the series strong with our next drug, Gemcitabine. Gemcitabine, or Gemzar, is classified as an antimetabolite, specifically a nucleoside analog. To understand gemcitabine's function, we must first understand the basics of its activation process. When gemcitabine is introduced into a cell, it is activated through the attachment of phosphate groups, a process known as phosphorylation. It undergoes this process 3 times to become gemcitabine triphosphate, the fully active final product. When activated, it can substitute itself for deoxycytidine triphosphate and incorporate itself into DNA strands as a normal nucleoside. However, because it is a faulty base that cannot be base paired, it effectively halts DNA synthesis, resulting in apoptosis. Gemcitabine can also disrupt DNA synthesis in its precursor form, aka gemcitabine diphosphate, by blocking the activity of ribonucleotide reductase, a critical enzyme required in the creation of new DNA nucleotides. This leads to a reduced supply, forcing the cell to resort to external products like gemcitabine. In this sense, gemcitabine effectively enhances its own activity by depleting a cell's supply of normal products in favor of using itself instead. It is a cell cycle specific agent, exerting its effects in the S phase. Gemcitabine can be used as mono or combination therapy and is indicated in the treatment of NSCLC, pancreatic, breast, ovarian, and bladder cancer. It is administered intravenously, typically as a quick infusion over 30 minutes. Frequency depends on type of cancer and combination regimen. It is considered an irritant. Common side effects include nausea, vomiting, hair loss, peripheral edema, rash, and flu-like symptoms such as fever or chills, typically within the first few days post-infusion. Patients should be encouraged to monitor their temperature and report any temperatures higher than 100.5 degrees, especially if it occurs outside the aforementioned window. More serious side effects include severe myelosuppression, pulmonary toxicity, which can manifest as pneumonitis or pulmonary edema, hepatotoxicity, hypersensitivity reactions, capillary leak syndrome, and hemolytic uremic syndrome, a potentially fatal condition that presents as a triad of symptoms including anemia, thrombocytopenia, and acute kidney injury. This is a medical emergency and requires immediate discontinuation of the drug and urgent workup. So, did you learn anything today? Stick around for more, and as always, let me know in the comments which drugs you guys want to see next.